Before we jump into today's episode, I am delighted to invite you to my free upcoming masterclass on 5 sleep supplements every physician needs to know. Our patients are taking supplements for sleep, yet we as physicians, as healthcare practitioners, we hardly get any training in how to use them properly, the indications, the contraindications, quality concerns, and so on. We'll be addressing all of that in the context of 5 common sleep supplements. People have told me things like, this is the best masterclass I've ever attended. It's so practical. I was able to use the information right away. It was so easy to understand. It was engaging. So I would love to see you there. It's completely free. It's live. You can come and ask your questions at the end of the class. I'm going to tell you about the Clinical Sleep Kit program, or CSK. Dr. Michelle Jonelis is one of our faculty experts inside that program, so you'll be able to learn from her today in this video. But come to the masterclass, and if you can't attend the live sessions, the recording will be sent out afterwards. So go ahead and sign up, and let's jump into today's episode. I'm delighted to be joined by my friend and colleague, Dr. Michelle Jonelis, and she's teaching us about dream rescripting. Whether you're a sleep medicine clinician or you're a physician who practices another specialty, this is going to be really useful and informative for you. This YouTube channel is all about clinical sleep medicine pearls for the outpatient clinician. If that sounds relevant to you, go ahead and subscribe. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep medicine doctor. Okay, Dr. Jonelis, thanks so much for joining me. We're going to be talking about dream rescripting, so I'm really excited to learn from you. And I'll let you introduce yourself and then take it away.
Okay, I'll introduce myself. I have a slide, so I'll do that. I'm just going to give you guys a quick short PowerPoint presentation about dream rescripting and just nightmares and function of dreams in general. Always a fun topic. And then hopefully just give you some tips so that you can use these techniques with your patients. Okay, so let me go ahead and share. Here we go. I like doing this presentation because there's so many pretty dream pictures and like nightmare pictures. And it was really fun to put this together and try to find all these cool, pretty pictures. So I hope you enjoy the visual aspect of the slides as well. Okay. Advancing. So I am a sleep and lifestyle medicine physician in the San Francisco Bay Area in Mill Valley. My practice is called Lifestyle Sleep, and it's focused on using behavioral and lifestyle changes to improve sleep and overall health. I'm originally trained in neurology, so I'm not technically a mental health professional, but I did a lot of training in what's called behavioral sleep medicine, which is using psychology and behavioral strategies to improve sleep, and then in lifestyle medicine, using lifestyle to improve overall health. And I kind of blend those two together in my practice. That's our focus. Okay, so I'll talk to you just a quick outline. I'm going to talk to you about nightmare definition and prevalence, the function of dreams and nightmares, factors that contribute to nightmares, treatments for nightmares, and then the dream rescripting exercise and some strategies for kids as well. Okay, so nightmare definition. This is from the International Classification of Sleep Disorders. I like this definition a lot. An internally generated conscious experience that seems vivid and real. They become increasingly more disturbing as they unfold. Emotions are characteristically negative and frequently involve anxiety, fear, or terror, anger, rage, embarrassment, disgust. So pretty cool. We all kind of know what nightmares are, but I like to have the definition. And I think there is a point of confusion, which is that patients will define nightmares differently, right? So a lot of us, it's very common for us to have dreams, stress. I call them stress dreams. I wouldn't call them nightmares, the type of thing where you are told you have a test and you haven't studied, right? You're back in college, or you have to, I'm a musical theater person. So there's a show and I'm supposed to go and perform, but I haven't learned my lines, right? Or you're trying to catch a train, right? And you like can't get there in time, or you're packing for a trip and all you get there and all you have is underwear, right? Like these are, I wouldn't personally call those nightmares. To me, that's a stress dream. I'm having it when I'm under stress, when I'm feeling like I don't have enough time for something. Some people do call those nightmares. So I find it helpful when you talk about it with the patient, just to get some idea of what it is. And it can just help with your explanation to them about what's going on. If they're distressed by it, you're going to treat it either way. But it just can be helpful. it means different things to different people. Okay, so nightmares are super common. The studies that have looked at prevalence, in kids, 50% of them report having had a nightmare. These are pretty young kids. And then by adults, 85% of adults report having nightmares at least once a year. Almost all of us have these. I don't know who that 15% is that don't. Maybe they just don't dream or don't remember their dreams. And then it's a less proportion of the population that would meet criteria for nightmare disorder. And nightmare disorder, interestingly, it doesn't have a frequency criteria. It doesn't say like you have to have nightmares at least 3 times a week, right? Usually these definitions, both in the DSM and ICSD, it'll have a frequency, but it doesn't. It just says you have to have recurrent distressing dreams that cause, some impairment in daytime function, basically cause chronic distress. So the way that you would know, is it nightmare disorder or is it just nightmares, is if the person's very bothered by it, they fixate on it, it's happening over and over again, it's affecting their quality of life. Okay, so function of dreams, so fun. Nobody knows, of course, for sure what the function of dream is, but there has actually been lots of research into this area that has tried to sort it out. We go beyond Freud and his, subconscious, unconscious, superego, all of that. We've moved beyond that to some empirical data, and we do have some idea of the function of dreams. I'll show you one of these studies on the next slide. But so dreams, we think, are important for kind of emotional processing and regulation. The tone of the dream often reflects our emotional state at that time. If we're excited about something, maybe it's a positive dream. If we're feeling really negative about the world, we're feeling anxious, maybe we have more of those stress dreams or nightmares. So it helps us to kind of tune into our emotional state and maybe regulate that a little bit during the process. Memory consolidation, right, and neural pathway reorganization. We take in all this new information during the day, and at night our brain is trying to sort through all of that, decide what to remember, what to forget, what to pair together, pairing things from the present with the past and preparing for the future. So some people think the dreams are kind of a byproduct of this. And sure enough, if you think about the content of the dreams, often you'll find things that happened recently, or maybe they got changed a little. Like I remember I had this dream about a penguin. I couldn't figure it out. Where did the penguin come from? And then on my drive to work, it turned out there was a sign with a penguin that I went by every day, and I'd never noticed it, right? But apparently my subconscious noticed it and put it into the dream. And then problem solving, creativity, during dreams, this is the big one that I love. This newer concept of dreams is that it's kind of a simulation of threats or novel situations. So your brain during dreams, one of the things it's doing is kind of putting you in these novel situations that you don't have during the day. And that can help you with problem solving and creativity. It can also help with self-reflection, insight, right? So maybe you're hearing about the war in Gaza. It's very distressing to you. And maybe you have a dream that you're there in Gaza. Maybe it's a nightmare, right? But that can also be a way of having not real insight. Obviously, you don't know what it's like to be there, but trying to kind of understand that and maybe have some insight into the situation, some self-reflection. And then I love this one too, practicing motor pathways. So during rapid eye movement sleep, where we tend to have at least our vivid dreams during the night, the brain paralyzes the body. And it's been this mystery, why does the brain paralyze the body? And my personal theory, which there's some evidence for, is that it's so that we can practice motor pathways, right? We can practice moving in these weird ways. We can practice running, we can practice jumping, we can even practice flying in our dreams. And we're not going to actually be moving in the bed, right? So your brain can kind of do whatever practice it needs to have. So this was one of the famous studies that tried to look at this, just to give you a sense of some of these things. These are from Bob Stickgold at Harvard. I don't know if you ever worked with him, Nishi, in your sleep fellowship, but he's in that area. So there was this famous Tetris study from 2000. This was kind of the first one, where he had subjects play Tetris for a bunch of hours each day. And then I don't know why he was interested in mentation at sleep onset, but he wanted to see what they were thinking about as they fell asleep. And so in this study, when they actually had fallen asleep, you were seeing sleep brainwaves, he would wake them up. And most of them reported seeing these Tetris-like images at sleep onset, right? Like their brain was kind of trying to make sense of it and practice it. And after the second day, they had more of this. It was like they were really getting into it. And then he did the same thing in 2010 with the skiing game. I don't know why he changed from Tetris, but this was interesting because in this study, he looked again at sleep onset where they reported this skiing imagery. But he also looked later in the night, like more in rapid eye movement sleep where we tend to have dreams. And what was interesting is later in the night, people weren't dreaming about the skiing game in general, but the content seemed to be very influenced by skiing. So they were at a ski resort that they'd been to as kids, or they were in the snow, or one of them was like a rocking motion, like they were in a boat rocking, side to side. The alpine skiing game is all doing that. So it was more subtly influenced by what they've been doing during the day. Okay. And so how do we think about, given this information about dreams in general, what do we think about nightmares, and why nightmares occur? So one of the big ones would be this threat simulation practice. If you're not feeling secure during your day, you're feeling under threat, you're feeling like you can't get a handle on things, your brain may generate a threat situation at night to have you practice this during the night. And then often if you have negative emotional affect or stress, that's going to play into it as well. But so what I like to tell people in thinking about this is that your brain, the nightmare has a purpose, right? Your brain is trying to protect you from and prepare you for some kind of potential danger. That's why it's making this nightmare. Okay, and there's lots of factors that contribute to nightmares. This is a very wordy slide, but I'll just go through some of these. So journaling dreams is a huge one that a lot of people don't realize. If somebody's having distressing dreams, more often than not, you ask them if they're journaling their dreams or discussing their dreams in depth every morning, and they are. And in fact, this is one of the ways that you can get people to remember their dreams is you just say, first thing when you wake up in the morning, just write down anything that was on your mind, and little by little, they'll start to have some dream recall. It reinforces the recall of the dream. So if they don't like the dreams that they're having, just stop the journaling. And sometimes that enough, just telling them, stop journaling your dreams, is enough for the dreams to go away. Maybe they want to keep doing it and you say, okay, that's fine, but that's going to reinforce the dreams, right? Like you got to make your choice. If you want it to go away, don't journal them. If you don't, then keep doing it. Reading or watching distressing or violent content. This is a huge factor. I had this teen who was having dreams of being chased and killed. And it turned out she was reading like the Hunger Games series a ton, right? And it was the content from the movie was being put into her dreams. And what was interesting is once I explained that to her and was like, your brain is practicing, it's trying to prepare you for these situations, it was no longer bothersome to her. And she could just be like, oh, this is interesting, right? Like I can enjoy the novelty of the situation. Thank you, brain. And it was more of an interesting thing rather than she was very distressed by this before I explained it to her. Okay, so negative emotional affect. We talked about this, stress, anxiety. Of course, PTSD and other psychiatric illnesses can give nightmares. Trauma goes along with that. But even if you don't have PTSD, you can have trauma dreams. Substances, alcohol, especially alcohol withdrawal. Often people will have a lot of dreams and a lot of nightmares because alcohol suppresses rapid eye movement sleep. Medications can do it. Like there's this anti-malarial called mefloquine, which classically gives nightmares and like really strange dreams. Hormones, cytokines, like when you're sick, you have a fever, right? You might have these bizarre dreams or nightmares. Environmental factors like changes in temperature. If it gets really warm randomly in the middle of the night or really cold randomly in the middle of the night, that can interestingly trigger a dream that you remember and sort of deepen it or lighten it. Anything that gives you irregular, disrupted sleep, like shift work, and then sleep disorders, it would kind of be in the disrupted sleep, like sleep apnea is a big factor, sleep, other sleep disorders, restless leg, that kind of thing. And so, if somebody's having dreams that are distressing to them, why would we treat the nightmares? What would be the purpose? So it's to alleviate distress. And again, this is the key question. If they're not distressed by the dreams, they find them interesting. It's, they find them helpful or just they're not worried about it. You don't need to do anything. If they are bothered by them, even if it's once a year or it's, one of these stress dreams that you don't think is really a big deal, right? Like if they are distressed by it, then you want to address it. Then you want to do some kind of treatment. And so if we get to treatments for nightmare disorder, this slide is even more wordy than the contributing factors. It's an alphabet soup here. But basically, these are all of the psychotherapy treatments. And then, these are the medications. And for psychotherapy treatments, there are so many out there. And the main category is these first two are considered cognitive behavioral therapy for nightmares. And then there's also just trauma focused therapies where these are not specifically for nightmares, right? These are other types of cognitive behavioral therapy branches off from that will focus on trauma. And then there's a whole host of other ones. And some of these are specific to the nightmares, in particular, the first two. The other ones, some of them are just like progressive muscle relaxation, right? Like they're just helping manage anxiety and distress. But what's crazy is if you look at the research, they all work. And I think this is really empowering because it suggests that even if you just all you do is provide reassurance or explain to the person about the nightmares, like they're going to have some improvement from that, right? You don't have to be able to do full exposure relaxation and rescripting therapy or, imagery rehearsal therapy. These are very labor intensive treatments. You don't have to do that. Like you can start with some progressive muscle relaxation and you're going to have some benefit. The research does show that the nightmare specific ones are more effective, right? So for people where it's very distressing, very frequent, they may not respond to some of these other things, but nevertheless, you can still start with those and you're going to get some kind of a result. What's interesting is the medications. The big one that people think about are prazosin. There's also medications used for PTSD or psychosis that have been tried, but really they're not very effective. And in particular, we used to think that prazosin was very effective for nightmares, but then there was this big randomized controlled study in New England Journal of Medicine, which showed that it actually wasn't, when it was a randomized placebo-controlled study, it wasn't effective. So it may still be effective under certain circumstances, but it's not like, oh, just give them prazosin, right? We know all the psychotherapy treatments are helpful. Nightmare specific treatments might be more effective. And we're talking in terms of just the level of efficacy, greater than 50% reduction in the number of nightmares per week with imagery rehearsal therapy. That's very consistent. Often it's way more than that. And in terms of distress from nightmares, huge reductions in that. So they're very significant effects versus, the medications, maybe mild effect, maybe no effect. Like just don't waste your time with medications and go to one of these psychotherapies. Okay, so where to start if somebody's telling you that they have nightmares, distressing dreams? So assess for contributing factors, sleep apnea. One of the things we used to see in my general sleep clinic was we'd ask about dreams of suffocation or drowning, right? And if they were having dreams of suffocation or drowning, it made us think that they were actually, being deprived of oxygen during the night from sleep apnea. And that would increase our likelihood that we thought they had sleep apnea. And usually they did. We'd put them on a CPAP machine and lo and behold, those dreams would disappear. So definitely worth assessing for that, particularly if you're getting that suffocation type content to the dreams. Oops. And then irregular schedule, right? Stress, dream journaling, assess for that, reading, watching distressing content, go through all of those factors. And then just explain to them the function of dreams. Nightmares can be normal. Your brain is putting you in these novel situations to try to figure out how to cope with the threat. But the important thing, which we'll go through with these treatments, is explain that they can decide to opt out, right? So you can actually kind of crazily, you can modify your dream content. And that's what we'll talk about with this strategy, dream rescripting. So if they don't like having this, they can choose to opt out, right? And then offer the dream rescripting exercise, which is so simple. I'll show it to you. We'll go through it and then follow up, of course, reinforce the message. And if they're not improved, refer to a specialist. They might need the full imagery rehearsal therapy or something like that, or just trauma-related therapy often. Okay, so dream rescripting, the concept is that you change the dream, right? So the dream with nightmares, we saw that in the initial description that it gets more and more negative affect, scary as the dream goes on. So there's always a point where it just starts as kind of a regular dream and then it becomes bad. And what you do is you just change it before it comes bad into something positive, right? So we'll go through this. So this is the exercise. You can write it out. You can say it. You can draw it if you're artistic, or for kids, sometimes you'll have them draw it. So you write out the beginning of a recent nightmare, stopping just before anything bad happens. People can, the client can choose to either tell you the whole dream or not. Sometimes if dreams are extremely terrifying or associated with past trauma, they don't want to go there, and it can actually be harmful to make them tell you the dream. So always leave it up to them. If they want to tell you the whole nightmare, I like to get some sense again of like what kind of content it is. So I'll say, is it chasing? Is it killing? You know, something like that in my initial intake. But if they don't want to tell you about the content, that's fine. They don't need to ever go through the whole dream. They never have to write that out. They never have to say it. They never have to draw it. They just need to go to the beginning of a dream that turned bad. And then you have them write down a new second portion of the dream, creating a story that is uplifting rather than scary or disturbing. And we say the more funny, ridiculous, outlandish that you can make it, the better. I'll give you an example on the next slide. And then these are kind of optional. They say, you know, read the new dream out loud, read the new dream out loud every day for 1 week. In truth, like I said, anything works. Like they don't necessarily need to do this. And in fact, making them do number 3 and 4 is going to be a barrier, right? You're going to lose a lot of buy-in. They're going to say, I'm not going to do that, right? So just have them do it once. If they want to do it, you might get more of an effect if it's really distressing, but it's optional. You can play around with that. And then repeat as needed each time you have a new nightmare, right? So they have another nightmare, go through the same exercise again. They have another nightmare, go through the same exercise again. And so here's just an example. So a man in a black, let me just move my picture of myself so that I can see this. Okay. A man in a black ski mask knocks on the door, then enters my home with a gun and assaults and shoots me, at which point I wake up. I'm going through the whole nightmare there, again, just for the purposes of illustration. They wouldn't have to say the whole thing if they didn't want to. The rescript is, I hear a knock on the door. When I go to open it, I find it's a beloved friend from college who is always doing crazy pranks. The friend is holding hundreds of balloons and convinces me to take a ride in a chair lifted up by all the balloons. I sit in the chair holding the balloons and then let them go one by one as I peacefully drift back to the ground. You know, it's a ridiculous dream, but that's the point. You're just turning it into something fun and ridiculous. Okay, let me move this again. How do I guess it doesn't matter. Okay, so how about kids? Kids, dream rescripting works fantastic. You can have them draw it. You can have them write it. I do this with my own kids anytime. Oh, I had a nightmare, right? We go through like, what do you think it was? What were the elements? And then I just say, okay, well, let's change it, right? Start at the beginning and come up with a different ending. And every single time we just do this. And, you know, they tell me less and less about their nightmares. But interestingly, I told you again, any intervention works. So there was this nice study with kids called the Dream Changer Study. And this is what they told the kids. It was kids ages 3 to 10. They said, sometimes you wake up from a bad dream at night, right? I want to give you something that will help you. This is the Dream Changer. It's a remote control, like the remote we have for the TV. When you don't like something on the screen, you use the remote to change the channel, right? Now you can do the same thing with your dreams. Dreams are like videos we watch in our sleep. Our brain creates them and we watch them with our eyes shut. From now on, you decide which video to watch in your sleep. When you get into bed, think about a good dream you'd like to watch in your sleep tonight. And if a bad dream starts screening, use this to change it. Okay, and just to give you a sense of, you know, the efficacy, this is just the results from this Dream Changer study, just to show you again. So 56 children, ages 3 to 10, the mean age was 7, and the nightmares went way down, right? This is the intervention, this is the wait list. You know, these are hugely significant results. Sleep anxiety also went down. Okay, so summary, nightmares are common. They may occur when the brain feels under threat and wants to simulate novel, threatening situations. Nightmare-specific psychotherapies are helpful when nightmares cause distress, and then dream rescripting is a very easy place to start. Here's a link to my dream rescripting exercise, the one that I showed you. Again, you can make your own. I told you what it entails. You know, you can use mine, you can use somebody else's. It doesn't really make up your own, is fine. This is just how to contact me. This is the card for my practice, Lifestyle Sleep in Mill Valley, like I said, and my website. And this is just a picture of my website. And then we can get into some cases if we want. But this was just, I just showing the slide for the picture, right? I like the picture. Okay, that's all I got.
Great. That was amazing. Thank you so much, Michelle. That was really, really informative. And I think, you know, some of the big takeaways are that, like you said, just any intervention can be helpful. Just talking to the patient about it and understanding, you know, what some of the causes might be, that in itself can be therapeutic. Could you speak a bit more about that? Like, what can the non-sleep clinician do? Like, maybe they're a psychiatrist or primary care doctor, pediatrician. What are some things they could say or do in sessions to help their patients with nightmares?
Yeah. So again, the dream rescripting is super easy. I only learned about dream rescripting actually pretty recently, like 6 months ago. And I've just loved it because again, it's so easy for anybody to do and it really works. But again, looking for those exacerbating factors, explaining to them the function, and then, giving them some kind of treatment. So before I knew about how to do any kind of nightmare specific psychotherapy, I would have patients in my practice who had nightmares. And I remember I was always like, they were my insomnia patients. I have a big insomnia practice. I do a lot of cognitive behavioral therapy for insomnia, and they'd come in with insomnia and nightmares. And I was like, okay, this is it. I'm going to have to learn how to do imagery rehearsal therapy, right? Like, I'm going to have to do this, right? I'm like preparing and getting all ready, getting the scripts and all of this. But what was interesting is none of them needed imagery rehearsal therapy. Their nightmares got better just with cognitive behavioral therapy for insomnia. And that's really what the research shows as well, right? CBTI, not focused on nightmares at all, does work to reduce nightmares. So I never had to do it, which is interesting. And then, like I said, the sleep apnea, that works. And this technique, the dream rescripting, what's funny personally is I'm lucky. I don't have a lot of nightmares. And when I do have them, I sort of am interested in the novelty of it, right? Like it doesn't bother me. I'm like, oh, that was really interesting. But since I have learned about dream rescripting, I don't have nightmares. I will wake up and just make a different choice. Like, to give you an example, this wasn't exactly a nightmare, but I had a dream where we'd been going skiing or preparing for skiing. So in the dream, I was in the ski shop getting all my rentals, for the skis and for my kids and all of this. And finally we like have all the stuff, we're ready to go on the slopes. And I realized I had my dog with me. And I'm in the dream, I'm like, what am I going to do with the dog? Right? Like, where is she going to go? What do I do about this? And what's bizarre is at that moment, I woke up and I just thought, just leave the dog at home. Why is she even there? And then I went right back to sleep, continued the dream without the dog. It was crazy. So this concept of, changing the dreams, I think is just really powerful. And again, even just giving them the handout about the dream rescripting, even if you don't do it with them, even if you don't, you do nothing else, like that in all likelihood is going to have a positive effect. So yeah, go ahead and play.
I love that because it's really empowering to people because sometimes when patients are having nightmares, it can feel like it's out of their control. There's nothing they can do. They're afraid to go to sleep because they don't want to have these horrible images in their mind. But these simple things can make such a big difference. And yeah, and I've seen this in my practice where, I'll ask people, well, tell me, what are you doing in the hour or two before you go to bed? And they're watching true crime documentaries or, like they're reading, like you said, reading these like violent like novels and things like that. Or maybe they're watching like House of the Dragon or, things that have like very
they're journaling about it in the morning about the
about, right. And so it's like, okay, well, maybe you can still enjoy those things, but maybe do them earlier in the day, not right before you go to bed. And as you were talking about like these pre-sleep cognitions, the types of thoughts that we have before we go to sleep can influence our dream content. So really being intentional about that can make a big difference.
Yeah. And I think with those people too, if they really enjoy the true crime dramas or the House of the Dragon or whatever, like you can explain to them again, this is fine, but you're going to have these dreams. And I think the combination of just reassuring them, explaining to them why they're having those dreams, so it's not a mystery. And again, the content is not going to look like it might look like House of Dragon or, whatever the true crime drama is, but in all likelihood, it's not going to. We know that from like that skiing study, right? It gets put in a different form by your brain, your dreaming brain. So explaining to them it might not look the same, which is why they didn't make the connection. And then give them the dream rescripting. And I think that will allow them to kind of opt out. The one caveat I will say is for people with severe PTSD and nightmares associated from that is the one group where I would also make sure that they're doing a trauma focused therapy, right? So EMDR, cognitive processing, treatment of CBT for PTSD, like you're going to want to plug them in for with a psychologist to address the trauma as well. And especially some of those people, let's say they were a veteran, they were in war, these nightmares can be quite complicated where they almost don't even want to let them go because they feel guilty about whatever happened. They can have this profound sense of shame and fear and guilt and terror about what they have done as soldiers. And so it's sending them to a veteran specific group, somebody who is skilled at addressing that can be helpful. But again, that person you send them to doesn't necessarily have to be skilled with nightmares in particular. They just have to be able to do the trauma focused psychotherapy.
Yes, thank you for sharing that. That's a really important point because I know a lot of the people who watch these videos are psychiatrists as well, and so they may be working with patients who have PTSD or complex PTSD. So that's really important to emphasize that trauma therapy piece, and also, as you mentioned in your presentation, recognizing whether or not there's sleep disordered breathing or sleep apnea because there's a high prevalence of that in that population. And I'm glad you mentioned prazosin as well, because, I see this being recommended all the time for nightmares, but it's really not all that effective, as you said. Could you speak to that a little bit more?
Yeah. So again, we had all this research showing like it was effective, but apparently that was just like retrospective chart review studies where like they put the person on Prednisone and they got better, which makes total sense because of what I told you. Anything you do for nightmares has a treatment effect, right? So they told them, I'm giving you this for the nightmares. And shockingly, the nightmares got better, right? But it turned out that it wasn't the prazosin or prazosin, however you want to say it at all, right? It was just that they were giving the person an intervention for their nightmares. And so I think that's what's really nice about that New England Journal medicine study, and a way to understand it, right? That like it did work because you were doing something. It's just you don't need to do a medication. The medication can have side effects. And so let's try, some of these other things that
I
are
mean,
more effective. Yeah.
that's such a good point because I actually just saw it on social media today, a psychiatrist recommending, prazosin for nightmares. And I was thinking, oh, maybe we should send him this video.
Yeah. Yeah. And again,
Yeah.
good job for doing something, recognizing that it's distressing, right? And, trying to
Yeah.
give it attention. There you go. You did great. But again, it doesn't have to be a medication. And of course, the focus of my practice is non-pharmacologic treatments of sleep disorders. So I especially love that result, right? Like we don't need medications for this.
Fantastic. No, thank you so much for teaching us and for sharing your expertise. So if people want to learn more about you or send patients to you, how can they find you?
My practice is called Lifestyle Sleep, and I love to see any patient that is struggling with their sleep. That's what I do. Anybody, particularly who's looking for a comprehensive approach that involves lifestyle and behavior change, or
And you
any on medications who wants to get off of medications. That is also an area that I specialize in.
and you see patients in person in Mill Valley and then
And
telehealth as well?
Zoom as well. So I can do telehealth all over California. They do have to be in California.
Well, thank you so much, Dr. Jonelis, for joining me today. And I'll put all of your links in the video description underneath. So everyone, you can go and check out Dr. Jonelis's website. She's available to help support your patients with sleep. And if anyone is struggling with nightmares that you're working with, you can refer them back to this video as well, and they'll learn a lot.
Can we put the link just to the dream rescripting exercise?
Yeah, good. Put that underneath too. Well, thanks so much for joining me today.
Thank you.